Welcome to the Functional Medicine Foundation's podcast, where we explore root cause medicine, engage in conversation with functional and integrative medicine experts, and build community with like-minded health seekers. I'm your host, Amber Warren. Let's dig deeper. Hi, everybody. Welcome back. We've got Michael Sermon here with us. We're so excited to have this conversation. Michael Sermon has been with Functional Medicine of Idaho since 2021 and became our medical director in 2023. He earned a bachelor's in human movement science from Utah State University and a master of physician assistant science from St. Francis University. With experience in family practice, urgent care, and emergency medicine in rural Texas and Oregon, Michael discovered the importance of lifestyle modification and root cause medicine for disease prevention and healing. He integrates traditional primary care with functional medicine, emphasizing patient involvement in healthcare decisions. Outside of work, Michael enjoys hiking, biking, ice hockey, and spending time with his family. His areas of expertise include foundational functional lifestyle approach to primary care, cardiometabolic health, men's hormones, and autoimmune conditions. And I can guarantee you that he has other areas of expertise as well that he's very good at. I've worked with him long enough to know that. Thanks for being here, Mike. We really appreciate this.
Yeah, glad to be here.
Good. So let's start. I just kind of want to start a little more general. What's your, I think our audience would love to hear your journey into functional medicine.
I would say it began, my wife, 99%. I mean, straight up, I had no idea what this functional medicine was all about. I would say 1% is because I was already kind of looking for more. I was sort of at this point of like, what am I even doing?
Yeah. And you were working in urgent care at the time, right?
I was doing a family practice. In a small clinic.
Okay.
At that point, I was probably 8 or 9 years into family practice, so I'd seen a few things.
Yeah.
I've treated a lot of things, and I've seen a lot of things, and I got to this point where I was sort of had this identity crisis of like, can I do this forever?
In what way?
I felt like I was inadequately addressing problems. I was just sort of treating symptoms and here's another pill. And yet, no matter how many prescriptions I would write, people are getting sicker and sicker. Mm-hmm. It got to this point where I was like, there's got to be a better way to do this.
Yeah. And so Shalise
And so she sat down one day and actually, at that time, she was having significant health issues that were not being addressed through conventional medicine.
Yeah.
And so she got to this point where she's like, I gotta change what I'm doing in my lifestyle or something. Have you heard of this? It's functional medicine. And I'm going, no, what is that? And so amidst of me being in my little crisis of like, can I really do this for the long haul? I wasn't really enjoying medicine anymore. It was just kind of like I felt like it was just a groundhog day every day. Yeah. Oh, you're not better despite quadruple therapy medications, and we're going, what are we even doing here? And one day after I had heard about functional medicine, I kind of researched it, and it's like, this is what medicine should be.
Totally.
Like root cause medicine. This all sounded like
should be good
exactly
medicine.
What I wanted to do.
Oh, cool.
So when she had introduced me to that, and I researched it and started listening to Weston A. Price Foundation podcast. I read about Institute of Functional Medicine and started even taking my first module.
Cool.
And at that point, I started saying, how can I implement some of this? So even before I joined functional medicine fully, I was already talking to my patients like, do you like this? Mm-hmm. Do you like that you're maxed out on all your medications? What if there was another way? And so I started saying, hey, I remember like really specifically this one gentleman came in and he said, what do I do now? Because he was on high doses of insulin. He was very severely diabetic. His average sugars were just through the roof, and no matter what I did to throw at this, he was on every medication under the sun that I could think of that was available at the time. And I said, "What? Like, this can't keep going on."
Right.
I was like, "What are you eating?" And he's like, "Oh, just stuff." And I'm like, "Okay, well, tell me specifically what you're eating.
Yeah.
And so he's like, okay. So he starts listing off the things. I'm like, let's talk about carbs, because that's obviously a big driver here with your diabetes. And I said, how many, so he said, I eat about 6 tortillas a day. I'm like, okay. And then he's like, oh, actually, no, it's 6 tortillas per meal. And I'm like, oh, so you're eating 18 tortillas a day? I was like, that might be a problem. So this was the first time this had even come up in a conversation.
With a type 2 diabetic.
Because it was always just like, you have this problem, and here's the disease fix, or at least we thought it was, right? And so I just sat down and said, what if you cut those tortillas in half? It's like humor me here, like work with me here, like be patient here.
Yeah.
I know this doesn't sound good because that was the staple of his diet, tortillas with everything. And so he kind of looked at me like I was crazy and asked me too much. And I was like, just cut them in half. And I kid you not, he came back in 3 months and his sugars were half of what they were. So he went from uncontrolled to now almost ideal.
Yeah, wow.
Not perfect, but he just came back and I said, what do you think? What'd you do? He's like, I cut my tortillas in half, like you said, you little dingbat. And I said, okay, that's cool.
You listened. That's amazing.
I was like, you listened to me? So he
so cool.
came back and he was just blown away. He was, almost in tears, just like, whoa, I could have gotten this under control.
It's so empowering for a patient.
And not long after that, he was off his insulin. He was starting to get off some of his medications. It was a game changer. And that's how I knew that this was what I needed to do.
Yeah, and you couldn't go back.
So that's when shortly after that, I had learned about you guys here at the Functional Medicine of Idaho. And after, 9 to 12 months of just kind of waiting for that time when it's right.
Right.
You guys, I think, were still building your building here in Meridian. And so when the time was right, I moved my family here until it was ready. And then we jumped on board.
And now you are the medical director of one of the biggest functional medicine clinics probably in America.
Yeah. So I think it was all meant to be, and the timing was perfect. And it couldn't have come at a more critical time for me, because I don't think I would be practicing medicine. I've learned to enjoy medicine again.
That is so cool to hear. So we rely on you, I know, a lot, because majority of our clinicians are female. So we rely on you a lot to take care of our guys. And you're really good at men's health. Is it fair to say that you see a lot of men that are maybe brought in by their wives that are not maybe into it, didn't seek out functional medicine or our care on their own?
All the time.
I figured. I figured.
All the time.
So how do you approach those guys that are maybe like, what is this? Why am I in this building? How did I get here? I'm here to just make sure my wife doesn't yell at me every day of my life.
There's going to be sort of a spectrum there, where some guys have maybe done a little research and kind of know that it's sort of lifestyle medicine. But we get some guys that are in there kind of like, what are you going to do for me? And I'm like, what can I help you with? He's like, I don't know. My wife just sent me here. You're supposed to fix me somehow. And it's like, okay. So I step back and I just gather information. I say, let's get to know you. Fortunately, in the functional world, we are allowed to spend more time with patients, which is a real game changer, because no matter how much you want to help someone, if you don't have the time to do that in this space, you really can't do much, and that's what I found out in my previous practice, was I just didn't have time to get to know them. So when I sit down with them and spend time with them, it doesn't take long before they're kind of like nodding their head. That's what I want. That's what I want. Yes. So it's not really that hard to convert most people when they know, their provider listens to them and gathers a history and cares enough to ask about, how is your sexual health? How do you feel about your dad that died at 50 from a heart attack? You know, how does that make you feel inside? Do you want to end up like that? So I like to use a lot of, previous patients' experiences to kind of say, hey, this guy came in and he had this going on, and this is what we did, and this is how he improved just by using simple holistic lifestyle modifications to really make big impacts.
Yeah.
I feel like functional medicine can sometimes be viewed as this really complicated, like, whoa, like it's going to be so overwhelming. Like they're going to do all these special tests on me and they're going to spend lots of my money to find out what, so that's where a lot of skepticism can come from, is like, man, it seems like a really heavy load investment in the beginning to find out what's actually going on. Going after root cause is not easy, and it's a very cognitive medicine, right? Because you're thinking beyond just symptoms. You're looking for the fires. You're looking above the smoke to be like, I know there's smoke signals, but where's the fire?
And it's almost never just one fire.
Yeah, and then you look around, it's like, oh, it's actually 14 fires. Okay, and so the skepticism of like, what can you do to really help me? And what are you going to make me do? Like cut out my gluten and dairy and sugar.
Take my fun away. Yeah.
So a lot of skepticism comes from their own mental block of like, I don't want to change, and I don't want anyone to tell me to change. And they certainly don't want their wife to tell them what to change.
Stop it.
Right. And so they come hoping that maybe I can present it in a way, or their wives are hoping that I can present it in a way. It's like, so that they're not saying I told you so, but, oh, my provider said to do this. And the wife's like, yeah, I told you to do that like 15 times. Like, did you not remember that? So when they hear it from me, I think it does help to have it come from.
For sure. And no wife wants to be managing their husband's care. Like, let's be honest. Like, none of us really want to be doing that, but we care about them. We want longevity in our spouses. We want them to be the best version of themselves all the time. And as men, leaders in the home and leaders at work, just like you are, you guys tend to put yourselves last. You're the last one to really seek that self-care and really take care of yourselves. That's my experience with my husband and his friends and our family. It's like, you come last. And so are you seeing like a movement maybe towards more men actually wanting to be proactive in their health?
Oh yeah, absolutely.
Good.
And some of them don't know what they want when they come in, but by the end of the visit, it's like, I think I need help. I think I can do that.
What are some of the more common ailments that you're seeing, or just constellation of symptoms you're seeing in men?
Lots of cardiovascular health issues.
Like what?
Because like I said, guys don't come to you until they're almost dead. That's just who we are. We feel this inherent, like we feel this like need to not let people see how we can be weak. Yeah. We don't like to show our weakness. We don't like to wear our emotions too shallow. We want to kind of be tough about it. Hey, it's super stressful, but it's just part of being a man, Right. And I think that's a societal thing that we've kind of put on ourselves more than it actually being a reality. So I think, that's a big barrier for guys, is guys don't go in for mental health.
Right.
And when they do, they start to realize, like,
I'm actually not well.
All of my friends are on antidepressants and all of my friends deal with this. Everyone I ask, like, deals with this. And when I share that with them, that's why I use examples to help sort of thin out that fear of like, I'm vulnerable here.
Yeah, I'm the only one.
When I tell people that lots of guys have this issue, you're not the only one with low T testosterone. You're not the only one that struggles with anxiety and fear of finances and being, the supportive husband in the family.
Right.
So, it's...
So you're seeing cardiovascular concerns?
Yeah, lots of cardiovascular disease, mental health stuff.
So let's break cardiovascular disease is kind of a big umbrella term. Yeah. So what are you seeing? Like high blood pressure, high lipids?
Pressure, high cholesterol, lots of high cholesterol. And some of that could be genetic, some of it can be lifestyle, how we eat, lack of exercise. So some of them can be explained, and then some of them might be more genetic predispositions. Lots of thyroid. I mean, I would say like 10 years when I was practicing, I didn't see a lot of thyroid issues and
100%.
Autoimmune disease like Hashimoto's and Graves' disease with guys, but it's...
You're seeing that with a lot of guys?
Becoming a lot more...
Thyroid issues,
Yeah, more common.
Why do you think that is? So let's talk a little bit about root cause. Like you just mentioned 4 really great conditions or types of disease states. What are you seeing as root cause, and how does functional medicine address those root causes?
Yeah, I think it starts with lifestyle, like what we're exposed to. We're in a toxic world, and it's just going to get worse. We can't really control all that, right?
Yeah.
So I think some of this is not necessarily things they're doing wrong.
Right.
But we can control some things, like what we eat, what we drink, how we exercise, how much, how we.
So where do you
stress.
start with guys? Because I can just picture that so many of your guys that didn't even want to be in your office in the first place, and now you're realizing that their blood pressure is suboptimal, their lipids are really high, and their thyroid's off. And then they're starting to realize, I actually don't feel good. My threshold I thought was here, but I actually don't feel well. How do you start with these guys that already are having a hard time buying into the lifestyle modification that we recommend in functional medicine?
Yeah, I start where they're at.
Yeah. Okay.
If they're not bought into something, if they're not invested into it, into my ideas and plans that I think will be helpful, they're not going to be successful. So I have to start with baby steps a lot of times. Like, hey, like this guy, cut your tortillas in half.
I love that.
It sounds so simple, but it changed his life.
Because if you told that guy to go grain-free, you would have lost him. He'd never step foot in your office again, right?
You start where they're at, and then you can build from there. And I mean, I've had cases where I'm thinking of a gentleman not while I worked here, but even before here, that came in, and he was an older gentleman, and he's like, hey, I'm fat. I have heartburn. What else? I have joint pain. I've had arthritis for 20 years. And I believe he's even pre-diabetic. So he's sitting here going like, help me.
Yeah.
And I'm like, well, let's look at your lifestyle.
Yeah.
Let's start with the baby steps. And he looked at me kind of like, okay, well, no one's ever brought this up. I thought you were just going to give me more pills. I was like, well, let's cut out. Let's do something. How far can we go with you? Like, are you willing to try some dietary things? And then let's start with that.
Yeah.
So we cut down on gluten, dairy, sugar with him, because those were kind of his big go-tos. And he's like, looked at me with kind of dagger eyes, like, how dare you? This can't possibly work. So I challenged him. I said, okay, forget everything else. Don't touch your medications. Don't change anything, but just change your diet and try those things. And he's like, okay. So I said, come back in like 3 months after trying to cut back, or whatever you feel like you can do. Like, just, if it's just sugar, cut back on sugar. If it's just eating less processed foods, go for it. Like, I'm meeting you where you're at.
Right.
And that's kind of my approach with people. And he came back in 6 weeks. He's like, I'm not coming back in 3 months. I'm going 6 months, 6 weeks. And he lost 10 pounds. His arthritis was gone. He was, and then his joint pain was gone. His lost 10 pounds, and come to find out he had constipation.
Yeah.
That he's like, oh,
Didn't
my
know I
bowel
had.
movements work
Yeah.
right. And so all the things that he had kind of brought up, he was like seeing results. And I was like, what'd you do? What's your success? He's like, what you said. I'm like, okay. No more dagger eyes. He was like, he was almost in tears. He was like, why didn't someone tell me this before?
Yeah.
Why are you the first person that has brought this up to me? Something so simple.
Right.
He's like, he just felt foolish.
It didn't cost anything.
It
didn't cost that.
Yeah, he felt kind of, I don't want to say betrayed, because in medicine we do our best with what we know.
We don't mean to.
But he just felt conned. This whole like,
Yeah.
I'm on arthritis pills and his acid reflux went away. So he's sitting there going like, I'm a believer.
Yeah.
Like,
so
this is
cool.
awesome.
He's bought in.
So meet them where they're at. Set ideal but realistic expectations and say, this is what I expect from you next time.
Yeah.
If you don't do it, I'm not going to kick you out.
Right.
Like, let's find out what the barriers are. If they're not exercising regular, I'm like, go for walks.
Yeah.
Go for a walk. Go walk with your wife. Go walk your dog. instead of driving to get the mail, go walk over to the mail.
Fifth mail, yeah.
You know, so for some people, I'm like, just stop eating out.
I know. Oh my goodness.
And see what happens. And that, like, almost every time that people take that serious, they come back, they're at least a little better.
And they're probably a little bit richer.
And they're probably
because last time I checked, eating out is really expensive.
It's no longer cheaper. It's it's convenient because you don't have to go home and cook. But
it's,
the reality is, it just doesn't take much to push the needle.
Yeah, I would agree.
These guys improve with just small little things like, gosh, if your work environment is toxic, figure out a way out of it.
Get out of it.
Or fix it. Talk to your boss, figure it out.
Yeah.
And some people come back and they're like, you know that anxiety I had for 20 years? It was because I had a childhood trauma I had to address.
Yeah.
It's like, oh.
Took care of it.
You know, so it can be just such simple things that can lead to chronic disease that are so simple, but not necessarily easy.
Yep. Are you looking for high-quality supplements? FunMedShop.com is carefully curated by the wellness experts at Functional Medicine of Idaho. You'll find high-quality supplements to support your health and optimize your body's natural functions. Rooted in responsible sourcing and utmost commitment to purity ensures that you're getting products that are not only effective, but also safe and reliable. Plus, you'll find our own line, Functional Medicine Foundations, which is carefully formulated using the best ingredients available so you can trust that you're giving the body the support it needs. Visit funmedshop.com today and take the next step in your health journey. That's funmedshop.com. I'm so curious what kind of symptoms you're seeing in these guys with thyroid disease.
Oh yeah, the classic fatigue, brain fog, weight gain. The guys carry it in the gut, you know, so you see beer bellies, even though they don't drink beer, you know. Brain fog, not able to focus.
Are you seeing as you fix their thyroid, testosterone levels come up, libido gets better, energy gets better, obviously, from fixing that thyroid?
Oftentimes, not always.
Okay.
Sometimes they can be pretty separate. Sometimes you'll address the thyroid and be like, you're still tired. Let's figure out like, and your libido's low. Okay. Right. Well, let's look at hormones.
Hashimoto's, I don't know, when I started training in functional medicine and really learning more about the autoimmune disease I was ignoring when I thought I was treating autoimmune disease, Hashimoto's was more known as a female disease, you know, women 40s, 50s, 60s. I agree we're seeing it in more and more men, but I don't see as many men as you do in my clinical practice. So I actually didn't know it was as significant as it really is in our male population. So why do you think we're starting to see it, and why do you think it's no longer like a female thyroid condition?
My opinion is we're probably looking for it better.
Yeah, I agree. Okay. We're screening men for thyroid antibodies, and we didn't before.
We're trying to find evidence of it, and it's not hard to test for.
Yeah.
But in my previous practice, I wasn't testing anyone.
Yeah.
Only if I couldn't figure out what was going on.
Right.
So I would it was kind of a last resort test. Now I screen for it. And now I'm seeing even more like what I thought were pretty rare conditions. Yeah. I'm seeing autoimmune hepatitis issues, autoimmune things we haven't even discovered, you know, but we're just seeing lots of weird things.
But the immune system's off, and we can look at labs to say that the immune system is hyperactive and ready to attack.
And that can manifest in, hey, I've got more allergies than usual because you've got an immune system that's overreactive. You're going to see that cascade into other systems. Like, how is allergies related to immune system? It has everything to do with the immune system. Yeah. It's our bodies looking at something as a lion when in actuality it's a cat. It's like, it's okay. It's just a nice fluffy kitty. It's not a lion. Yeah. And that's what our immune system is kind of like, shoot at will, like whatever comes into the body, it overreacts to. And so you see these people as just overreaction. Instead of just shooting the bad guys, it shoots the good guys too. Yeah. And so you really just think it's because we're screening more for it? We're partly, but I think there's also a growing concern of toxicities and environmental exposures that I think are playing a big role. Stress. I mean, what kind of we don't know for sure, right? Because there's so many factors. But it's a hard thing to test for. Yeah. We've got, you know, I don't know. Yeah. And it's okay that we don't know. Yeah.
Because at least we know how to treat it. We know how to support the body. And
I don't like that I don't know, but
yeah.
I also know that we don't have all the information. There's just so many factors we can't quite put our finger on.
Yeah.
But I suspect that it's not just one thing. It's always usually multiple factors. There's genetics. There's how do we detox? How do we get rid of things out of our body is really important too, because then that thing can trigger our immune system if we can't get rid of it. So I think it's a multifactorial issue that it's probably not just one thing. Yeah. It's probably it's like that perfect storm we talk about. Like this happened and this happened. It could be from a past trauma as a child that it comes back to haunt us.
Are you starting a lot of your guys on thyroid replacement and seeing good results with that?
Yeah, a good number.
Good.
But yeah, I would say probably females still a little higher.
Okay.
But I would also say females seek help first. Then.
So you're catching it sooner in our gals than you are.
I think probably.
Guys. Yeah.
But yeah, there's a growing number in men, and it's not just thyroid, but just all autoimmune disease. We're seeing higher rates of cancer at younger ages too.
And would you say the cancer and the cardiovascular statistics, you think it's the same, where it's probably just this combination of insults that's causing the disease state to happen younger and younger?
They're all kind of dominoing on each other somehow.
Yeah.
I think it seems pretty clear that there's a domino effect. And that's what functional medicine allows us to see, that through that lens of like, hey, this isn't just one problem.
Yeah.
It's not just a heart attack. There's immune system involved there too that reacts to inflammation. And so our immune system is trying to help us, but in the process, it also causes problems.
Right. This is probably a hard question, but if there's guys listening at home or women listening at home that want to know how to encourage their guys, maybe it's a gentleman that would really never step foot in a functional medicine clinic, or can't afford it, or doesn't have insurance, or doesn't live here. Name the reasons. What would be the advice that we'd give that person on where do they start? They know they don't feel well. They know there's health issues. They are fearful of their family tree and the genetics that are playing a role there. Where would you advise that they start?
I got to go always back to the lifestyle. I think take a close look at that. How busy are you? Or how stressed are you? Are you doing things to get me time in there? Are you exercising like you should? Are you over-exercising? Those are the questions that have to be the pillars. Yeah. And those serve as the foundation to anything else you do. Yeah. So I have to start with those. If we can't optimize their diet, exercise, stress management, and their sleep, you don't really get much. You don't really get far. Yeah. Because one of those crumble, and you've got an unstable foundation that is hard to build upon. But other things they can do is like be engaged with their provider and say, hey, I want to look at this. And if that provider doesn't have the tools to do that, whether it's in functional medicine or in conventional medicine, look for someone that is willing to have that talk with you about, hey, I feel like I want to look at my hormones. I want to look at my thyroid. I want to look at my gut health. The gut is so important, and that's one of my big things I go after first is let's start with your gut health. Are you having regular bowel movements every day? Like just simple stuff that it's like, duh, why are you asking this? Like, this is important. Because that gut and the immune system are so intimately connected, and hormones and mental health, so anyone in the functional world knows this, and trying to present that to a patient in a way that makes sense. I use a lot of analogies. So that's where I like to start with a lot of guys is like, hey, what do you do for a living? Like, let's use analogies that make sense. So if you're a truck driver, let's use an engine. That engine can't run without certain parts working right, without the right fuel, without the oil being changed regularly. There's things you have to maintain in order to get good life out of that engine.
Any guy can resonate with that.
And a lot of women too. I use this for everyone. Yeah. But if you want a engine to go 200, 300,000 miles, what can you do early on to prevent that to make that happen, right? And it's those little checkpoints of making sure that you're staying on track. 1 degree off for a week off our good lifestyle choices is not so impactful, but a year off that can cause so much damage, you know? But yeah, I like to use a lot of analogies to help patients kind of like, ding, the light bulb goes off like, okay, yeah, I get that. And so I use a lot of that in my teaching and plans to be like, this is what we're working for to get you a good head start. And with my guys, I'm just like, don't you just want to age gracefully?
Do they? Do they say they want to? They really do.
Because
I talk about that all the time with my women.
Yeah.
Because we all want to avoid the aging process as
like
women.
We're all going to die.
Yeah.
Like it's true. I mean,
you want to feel good.
Except me, I'm going to live forever. But
you probably will.
We're all going to die and we have to accept that. But at the same time, I don't accept going out kicking and screaming.
Yeah.
I don't think we have to go out like that. We can do stuff. Like, we can't control politics. We can't control this wildfire smoke. We can't control a lot of things. But gosh, if I have a choice between going down this path of like really good health and my heart's going to stop at some point. I die in my sleep at some point. That's a good peaceful way to go. Your journey is done.
Right.
Great job. You took care of your body. Or I'm on dialysis, or I'm, taking a lot of medications and things that don't sound so great because they aren't.
Well, and how about dying with cancer?
And like just pain.
Yeah.
Like who wants to go down a path? If you had a crystal ball and said, this is your path to living a healthy, long life of 110 years old, and you feel like a 30-year-old, like, of course we would choose that.
Yeah.
All right, this is what you got to do to get there.
You actually can.
And these are the tools on how to get you. This is your plan of action to get there. We probably would do it because we saw the end result.
And there's so much research on that, on optimizing longevity. It's the precision age reversal program that Dr. Holhaus is offering here at our Eagle Clinic. There's so much research being poured into that. I think people think of what you just said and think that's so unrealistic. There's no way you could ever feel like you're 30 at an older age. And it's like, no, there actually are ways to do it. You have to be precise and you have to be willing to invest a lot of resources, money, time, energy, make sacrifices, but it might be possible.
And it might even be more simple than you think. Like, hey, I'm going to eat more fresh caught salmon.
Yeah.
I'm going to just exercise, make it a priority to just really nail down those lifestyle things. And then, you get that other crystal ball, like this is your life on a terrible, bad lifestyle choices. It's like, of course I wouldn't choose that.
Yeah.
But what are you willing to do to prevent it? And that's, I guess, the challenge in functional medicine is like, how do you prove you prevented a heart attack that never happened, right? And so I like to think that, hey, your dad died at 50 of a heart attack and you're 60.
Yeah.
That you must be onto something, right? Because if you were to follow that same genetic predisposition, you would be dead now.
Yeah.
And so I like to think that if we were to pull out long-term studies of data from a more holistic approach versus like a Band-Aid approach, like take pills and quick fixes, reactive medicine, I think you would see very different results and be like, okay, there must be something going on here that we can take control of this and we can prevent and we can slow down that aging process so that we go out peacefully instead of kicking and screaming.
Like you said. That's so good.
Yeah.
Anything else you want to share on your practice or just men's health in general?
Yeah, I would just say, for all the guys out there, don't put off getting help, even if it's just simple, like low energy, you don't need to live with that. We're seeing such low T levels. Testosterone is reaching a weird point where our 20 and 30-year-olds have levels of 60, 70, 80-year-olds.
It's its own
astounding.
epidemic. It is astounding.
In fact, if I see someone over 500 or 600 testosterone, I'm like, what are you doing? I know there's 20.
What are you avoiding?
I know 20-year-olds that would kill for your testosterone. What are you doing?
Absolutely.
And, ask the questions. If they're the hard questions are the hows and whys, and that's what we're willing to take on.
Absolutely, yeah.
And we don't always have the answers, but instead of being dictators, we like to be detectives. And I think medicine has become a dictatorship in a lot of patient-provider relationships. And I think turning that around and saying, no, you have a choice here. Do you want to be proactive or reactive? So I would just encourage people to be proactive, like ask the hard questions, like make us think. We're trained in medicine. We need to go back to biochemistry and say, hey, I learned this at a cell level. Yeah. Let's teach these patients how to help themselves. And so we want that to be a working relationship instead of just a one-sided do this because I said so. And then in medicine, we've kind of created this like, oh, don't ask questions because I know what I'm doing. Don't question me. I gave you this pill. Just take it. Be quiet. Go away. I don't have time. But
they're right. They don't have time. In their defense, they actually don't. They don't have time to answer all the questions and really meet the needs of each patient they see. Yeah.
And I know because I was in there.
We all were.
I was in the trenches for years.
Yeah.
And to engage your provider and just, I would challenge people to ask the questions and say, what can I do and if they don't have the answers, go seek for someone that does.
Yep, I agree.
It doesn't mean we all have the answers. We just have a different lens to look through. So I don't ever look down on a traditional or conventional practice because it's so important to have that. Like we need to know how to treat strep and pneumonia and fix a broken bone.
Yep, I was just going to say fix a broken
bone. We got to go fix a brain bleed. I'm not going to rub an essential oil on a brain bleed. I'm going to go get a neurosurgeon to fix me. Like, thank goodness we have cardiothoracic surgeons that can do open heart surgery and give me more life, But what we aren't good at in medicine, or that we're at least getting better at, is the preventive care. Not ever getting the disease, right? The scariest thing you can hear is like, well, you have prediabetes, but you don't have diabetes yet. So just,
we'll just wait till you get it.
All I knew back not long, 10 years ago was like, well, you don't have diabetes yet, but come back when you do and we'll put you on pills, I was never satisfied with that. And I think a lot of people aren't, but we just don't have the time to address that. So yeah, just be proactive, ask questions, be engaged with it. Yeah. Learn. There's so much information out there, and you got to be careful because everyone's a Facebook expert. You have to be careful of your sources and do your research, and don't hold that research against your provider because they may not have learned that. I have patients all the time teaching me, like, hey, did you hear about this study? I'm
all
like,
the time.
No. Yeah. Send it to me. I love it. Yep. Like, I'll listen to it. Hey, what's that podcast you listen to? Yeah. Great. Let me listen to it. Like, learn more so I can help you more. I think that relationship is way healthier because now you're human. Like, we all make mistakes. We don't have all the answers, but
we can't know it all.
This partnership is so much more healthy, and that's what I've enjoyed. Is like, this is what I think. What do you think? Do you feel like you're up to that? Yeah. Do you think you can do this? And when they say yes, like, I could do this. Yeah. Cool. Let's do it. Yeah. And then let's follow up and make sure we keep eyes on this.
Let's keep the relationship.
Oh, you don't want to do this medication? I got 15 other tools on my belt. Let's go for it. Let's try that first and see what happens.
That's the beauty in functional medicine.
You can still practice safe medicine, but think outside the box and say, hey, is there a better way to do this in a natural way? Is it as just simple as a diet change,
I love that. So much good wisdom and tidbits that you gave our listeners. I really appreciate it, Mike. Thanks so much for your time.
No problem.
Thanks for your dedication as our lead medical director. We just so appreciate all your wisdom and your leadership and just the way that you love on your patients and also just love on our team.
Yeah.
Thanks, Mike.
Thanks for your time too.
Thank you for listening to the Functional Medicine Foundation's podcast. For more information on topics covered today, specialties available at the FMI Center for Optimal Health, and the highest quality of supplements and more, go to funmedfoundations.com.